Good morning. I'd like to call to order the October Tobacco Settlement Agreement Fund meeting. Madam Secretary, please call the roll.
Senator Chambers Armstrong, Senator Herron, Senator Reed,
Here.
Senator Richardson, Senator Webb, Representative Pfister,
Here.
Representative Hancock,
Here.
Representative King,
Present.
Representative McPherson,
Here.
Representative Works,
Here.
Representative Dossett, Co-Chair Howell,
Here.
and Co-Chair Pollock.
We do have a quorum. Before we start, anybody have any guests they need to or would like to recognize? Hearing none, do I have a motion for approval with the September 18, 2025 minutes? It's been a motion by Representative Pfister, second by Representative McPherson. All in favor, please say aye. All opposed? Everybody's waking this morning. It's good. I think that everybody's just rushing through to get to you, Mr. Reed. The floor is yours to introduce your guests. You know the drill.
Thank you, sir. Thank you to the Tobacco Oversight Committee. It's always a blessing to be in front of you all to make sure that the entrusted funds that we have that is moving Kentucky agriculture forward is correctly spent and accounted for. And we thank you all to the Tobacco Oversight Committee to making sure that that process is stable. We have a lot of conversations not only in the Commonwealth of Kentucky but across the nation. And Commissioner Shell is always working hard on our behalf. And when he's in D.C., he's always promoting what we have in place here. And people are just amazed at the foresight and the vision that we've had over the years and what we have in place. Other states are really jealous of the programs that we have put in place. And that all goes back to House Bill 611 in 2000, the continued process that you all have in tobacco oversight and everything that you all bring to the table. It's truly a blessing. I'm just going to jump right in. We've had a busy month since last time. As you can see there, we have a few activities. The first one and the one right below that, I'm gonna hang on for just a second. But if you can see, I know Chairman Dossett. I think Chairman Dossett's up there in the room. Chairman, if you can see, I think we was giving you a shout out. That's the radio station. I think you look at that radio station. I think you see it's familiar. We're down there and talking to Alan and everything, and we gave Chairman Dossett a shout out while we was in his town, and then he was texting us while we was on the radio. So that was always that's always a blessing to be there and have those conversations. But Commissioner Shell's just giving a update. We was down there. That was September 17th. We was drive on our way down to Murray for Farmer Appreciation Day, and we stopped in the radio station there to give an update about ag in the classroom that week. Commissioner Shell visited about 14 schools across Kentucky, from West Kentucky all the way over to Greenup, and had a wonderful time that week. And we was just in town that day to give some updates. On the right there, there's Commissioner Shell in Shelby County. Senator Reed, and he's saying hello to the National Watermelon Queen there. So she came in for a visit there on one of the farms, and she was just in town, so we was just getting to talk to her, and then Commissioner Shell was making some farm visits that day, so it just worked out that she was in town that day. Bottom right, there's Commissioner Shell speaking at the Lake Cumberland Ad District at their annual dinner. There at Lake Cumberland State Resort Park, and so that was a wonderful crowd, and he was just giving an update. And again, a lot of his conversation had to deal with what we're talking about today. So, and then there in the middle bottom, we had some delegation. We had Miss Bailey, we had Sarah, we had Bill. That was it. You all went down to Tennessee. They got the new Commissioner of Agriculture down there in Tennessee. And they went down there to talk about some programs. And I'm going to let Bill kind of jump off of that, but then I'm going to let him talk about the two pictures that I skipped, because before Bill talks about those pictures, we have another year of celebrity in our presence. Bill was reelected as the president of the National Association of Finance across the states there, and he's going to talk about that a little bit, but we're just proud of him. He served as president last year. Did a remarkable job, so good they want him back another year. So, Bill, why don't you talk a little bit about you all going to Iowa and then that Tennessee trip too?
All right. Well, the Tennessee trip, we Representative McPherson. We also noticed Al Pettigo's in there and Dr. Gordon Jones, two of our board members that live right there on the Tennessee line. So we were meeting with the Tennessee Department of Agriculture. They came and visited us, I think, 2005 to look at our model for our cost share programs, which is a decentralized approach where we work with the different entities like the conservation districts out in the state. And they went back and formulated a plan of a centralized approach through their take applications through their Department of Agriculture. And I'd always thought that was funded with their master settlement agreement. Actually, they fund their cost share program with excise tax. So at the time the master settlement agreement funds became a reality, they were short in their state budget, so they've been using the master settlement agreement. So it really just leaves two states, Kentucky and North Carolina, to use their master settlement agreement funds to support agriculture. Good visit to talk to them about how they're managing and administering the program. We're going to share all that information. Senator Howell tomorrow with a joint meeting of the two Ag Finance, Ag Development Boards. We look forward and review a study we had completed recently with KK&P study to look at how we can better, more efficiently run our operation and invest these funds in programs and projects with your all's support. So yeah, we did get out to Sioux City in Iowa, and you can see that top left hand, that's Hunter Jones and Hannah sitting over here to my left. And of course, my work boss did make it, but if you look down the bottom left hand picture, you'll see them. Looking at the picture to my right, that's my home boss, Linda McCloskey. So she's a retired school teacher, and so I don't get things done right, she lets me know I need to do them again. And then of course you got Hannah and Hunter attended the meeting. So it's about 30 states attended this conference. And when I attended my first National Council of State Ag Finance Programs, Representative Rourke, back in 2001, we were just thinking about a loan program. At that time, Kentucky Agriculture Finance Corporation was basically an entity of the Department of Agriculture that was dormant. And so from information we received from other states that manage loan programs, we organized, developed the program we have today. We're a $180 million loan program. We're as big as some small community banks across the state. So we're at the top. Is visiting these 30 states. They're amazed at how we've been able to grow our loan program with a master settlement agreement. Even have some states that say, what is the master settlement agreement? Well, I said, well, let's Google it. And you can Google that. If you have trouble sleeping at night, just Google master settlement agreement of 1998, and you'll find out how much money your state is receiving and what they're doing with it. Most states are using it to balance their budget or support other programs. So we've really been fortunate to be able to develop the loan program they have now as Kentucky Agriculture Finance Corporation. So yes, I was honored to serve as president again. For next year, we'll be meeting in Arkansas. So look forward to making that trip down there with more of my coworkers and my home boss, most likely.
There you go. Well, congratulations again, Bill. We're all proud of you. I know you all are, and that's a huge testament to what we have in place here in the Commonwealth of Kentucky, and we get to brag a little bit about that, so we're proud of that. As always, I'm proud of our staff. We have some staff in the room with us today. As usual, we have Miss Hannah, who keeps us straight in the office, does our boards and special projects, keeps us all going. And then in the audience, we have Alandria. She does our loans. We have Sarah, who does our programs, and then we have Rachel, who's one of our interns this year. Is everybody? Mm-hmm. We good? All right, I think we got everybody. But we're fully staffed right now, and we're looking forward to everything that we have in place. But I'm always proud of our staff. If it wasn't for them, none of this would be possible. So I just want to give credit where credit's due. Coming up in September, you'll notice in your all's packets, y'all have our results of both of our board meetings, Ag Development Board and Ag Finance Corporation. But Ag Development Board approved $950,000. Ag Finance Corporation approved $3.3 million across Commonwealth, Kentucky. And as you all see there, our staff was busy once again. 2 staff members attended the Competitive Leadership Programs Kentuckiana Agribusiness Leadership Academy. That's Kayla. And then 9 County Agriculture Development Council meetings, 6 site visits conducted by staff, 14 programs closed out, and 25 ag development projects reports were received. And then for September approval breakdown, you see the approval in both categories, ag development approvals and finance corporation. 4 county agriculture incentive programs totaling $487,000 and some change. 1 deceased farm animal removal programs total about $15,000. 3 shared use equipment programs, $31,000 and some change. 1 youth ag incentives program totaling about $10,000, and 2 county and state projects totaling $260,000 and some change. And then over on the finance side, we had 9 agriculture infrastructure loan programs totaling just over $1 million, 1 agriculture processing loan at $40,000, and 10 beginning farmer loan programs totaling just over $2 million. And tomorrow we have a big day. Our finance board meeting will be meeting. We have over 20 loans and about
$5 million.
About $5 million. So it's going to be a big day for us. So Senator Howe, I know you was wanting to come tomorrow, and so you get to see that process and how we go through the process. And it's going to be a pretty historic day money-wise for us. I also just want to tell everybody that, as promised, we have available to hand out to you all today when you all leave the KKMP report that was conducted from 2015 to 2022. That report has been bonded and ready to go. Our board has been looking at that for the last couple of months. We will have some meetings in the next couple of months for them to take a look at some recommendations that the staff has and then the report has, and they will go through that process. But that report is here today for you all to have. So when you all leave today, that report will be given to you all so you can have it for y'all's consumption. And then we're up to Bill and Brandon's top September picks. And before I let Bill go into a couple of the projects that we've seen last month, I just want to remind everybody about statute. We always have an annual report that we present to you all. This year, that annual report will be given to you all. It's being printed right now and going through that process, so we're really looking forward to that. But it's a little special this year just because it's our 25th anniversary, so we have a little bit more going into that report than usual. And so you will have that report in your hands by the close of this calendar year. And so we're really looking forward to you all seeing that and seeing the activity that we had from the last year. But at this time, I'm going to turn it over to Bill for Bill and Brandon's top September picks.
All right, we'll start with page 14, Organic Association of Kentucky. So you can see they requested $425,000 in state funds. The Organic Association of Kentucky, obviously working with organic producers, there's a process of getting certified to be able to sell products as organic. When I say products, we most associate with vegetable production. And it was interesting, one of my first visits on an organic production, vegetable organic farm, he said, this is value-added production. And I hadn't really thought about it in that term. So it is value-added production for producers, but again, there's a certified process that they need to go through working with the Department of Agriculture and also the Organic Association of Kentucky. And you can see that they've been successful since they were organized in 2010, securing USDA funds to help with this initiative. And one thing I've learned in meeting with this organization, working with the organization, it's more than just the produce or vegetable side of it. It's organic production going on in the state. Also includes milk production, also grain production, which is very important when you consider all the organic egg production we've got going on in the state. I know initially when we started the Ag Finance Program 20 years ago, we basically had 3 integrators or three poultry companies, Purdue, which Cromwell's in Ohio, Tyson's scheduled, they've got several operations across the state. Seabury in Webster County is one, and then Pilgrim's Pride in Mayfield. So those are historically have been our poultry processors or integrators working in the states. Recently, in the last couple of years, you've seen a lot more organic egg production going on in the state, where we've had producers requesting funds from the Agriculture Finance Program with the loans. So some of them are Hanson Brook, you may have heard of them, CWT, Happy Egg. Recently, Sunnyside Egg Production, just recently visited with them over the phone in Christian County. There's Stagecoach and Trail Organics. That's probably a new one for you. So what the point I'm making here is having organizations that helps with grain producers and grain processors to provide the feed for all these organic poultry operations is important. The board, as you can see, they requested $425,000, only approved 1 year funding for $209,000. So the board is struggling with reoccurring applicants. We're probably up to about 11 organizations that have received funding for 6 years or longer. So that's one of our strategic our meeting topics this Friday is how we move forward with funding reoccurring entities out there. And so, although a lot of them provide that technical assistance, it is important as we diversify into other enterprises, away from tobacco, which I think we've effectively done that at this point. We'll continue to evaluate these different organizations that come in at request funds from the ag development, especially on the reoccurring. So I think the board is looking at a report here in a year from now and see where they're going to go as far as supporting this entity going forward. All right, no question. We'll go on to page 15. We've got Joseph Dale Bentley requested $51,300 to construct an expansion of a small ruminant facility in Lewis County, specifically for goat production. So this is one of the more interesting calls I've gotten over the years working in Frankfort. When you get a call out of the blue and says, I am working with Kentucky farmers to market goats in other countries. You ask that second question. Okay, repeat that again. He said, well, I have established a business. I am a teacher, and I started this on the side, and it's become a full-time business where I am marketing goats to Jamaica, Bahamas, St. Lucia, the Philippines. He's got 162,000 followers on Facebook across the world following what he's doing. And when he presented the board, they just kept asking question after question. They were just really enthralled with what he was doing because it's creating market opportunities for our farmers, specifically goat producers. And when you think about what the mission of the Ag Development Board and looking at projects, funding projects, supporting projects, are going to create market opportunities for our farmers that fits in. As a result, the board approved $51,300, which is half the cost of upgrading his facilities to be able to expand this business he currently has.
Thank you all so much. That concludes our report. If there's any questions, we're here to assist in any way we can.
Anyone have any questions for anybody? I've got one random one.
He handles those.
No, it's with you. Two random ones, actually. One, congratulations on being reelected. I don't want to know if that's really an honor or if that's like getting reelected as the church treasurer.
Well, it gives you opportunity to create personal growth
There you
opportunities.
go.
Let's say
Opportunities for
that.
growth. That's what we're all about. That's what we're all about. With the gentleman that was doing the goat contracting, was that all overseas or did he do any in the country?
I think most of it's overseas. I think that's where his specialty is because there's a requirement of quarantining the animals and working through the paperwork. So I'm looking forward to going up and visiting his project when we do get to the point of dispersing the funds to the project and getting more information about it. We did consult with there's the organization, Ag Development Board, helped get started, the Sheep and Goat Association. So we visit with them and they've supported the project. And so we'll continue to learn more about what they're doing with this project. Really an interesting project. And it's not a pipe dream. It's something he's currently doing right now. So I think that gives the board confidence in supporting this project and see where he can go with this.
Yeah. Thank you. Representative King, I believe, has a question.
Thank you, Mr. Chair. Like you, I'm fascinated with the goat project. As someone who's interested in nutrition, I'm fascinated with all ruminants, whether large or small. So, what aspect of this project was the board interested in helping him expand? Because I think, all ruminants may be looking for that type of support. So I'm wondering how will he utilize this expenditure?
He wants to expand his facilities, has right now, specifically in infrastructure, building to be able to house more animals in there and get to where maybe he can do actually the quarantining at his location or farm there in Lewis County. So just being able to expand and be able to market more animals. And
so it is infrastructure, not necessarily marketing or cooperative.
He already has that part down. He's
Okay.
already got that the process. He's actually doing it. He's actually he went in the whole process of talking about how many goats he puts in a crate when he ships it out of the country. So he's done it. He's got a good example, good history, body of work, so to speak, to do it. And we finally had to cut the board off on all the questions they were asking. They were so impressed with what he's going. And it's it's interesting and even exciting to see these type of projects just come out of nowhere. They give you a call and say, hey, I'm doing this. I heard y'all got some funding that really helped me expedite my expansion process. So great fit for the Ag Development Board.
Well, it's wonderful that this is a ruminant projects because for somebody that may not be familiar, that is the type of animal that can eat horrible vegetation and then either create milk and or protein. So they take a landscape that's not able to support the people living there and then gives them an opportunity. Really fascinating. Thank you. Thank you, Mr. Chair.
Thank you. Anyone else have any questions? All right. Thank y'all. Appreciate your time. Appreciate you coming in. Next up, we have people here from the cabinet, Julie Brooks, Andrea Day, and Sarah Johnson. If y'all can make your way forward, this isn't your first time either. Get in, get settled, green lights, and introduce yourself, and the floor is yours.
Good morning. I'm Julie Brooks, the Policy Specialist with the Department for Public Health.
Good morning. My name is Sarah Johnson. I'm the Director for the Division of Substance Use Disorder within the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Good morning. My name is Andrea Day. I'm the Director for the Division of Child Care.
So thank you for this opportunity to give you our annual update on how the Cabinet is utilizing the funds from the Tobacco Settlement Agreement Fund. First, I'm going to start with our HANDS program. HANDS is recognized by the Federal Health Resources and Services Administration, or what we refer to as HRSA, and the Administration of Children and Families, as an evidence-based model for early childhood home visitation services. Families can enroll during the prenatal period up to 90 days after birth and can continue in services until the child's third birthday. Services are provided through our local health departments, and we have 2 contracted agencies that also provide home visitation services. These entities are known as our local implementing agencies, or what we refer to as our LIAs, and they actively engage in outreach efforts to support pregnant women, families with young children in their local communities. HANDS home visitors work to establish a trusting relationship with families, and consistent with the aims of HRSA and in accordance with KRS 211-689, HANDS has the following goals: supporting healthy pregnancies and births by helping to reduce preterm births, promoting optimal child growth and development through positive parenting practices, focusing on school readiness, and seeking to enhance the social, emotional, and cognitive development of children. Ensuring children live in safe and healthy homes through screening and referrals for needed health-related services, and that can include referrals for not just the child, but also the parents or other individuals in the home. And then empowering families to be self-sufficient by giving them the tools necessary for success. So in fiscal year 25, the funds were able to support and maintain a stable workforce. We did increase the number of families served. Look at my number. So in fiscal year 24, there were 6,293 families, and as you can see here, that number increased to 6,715. And we also increased the number of services provided. In fiscal year 24, there was 139,943 services provided, and as you can see, that number increased to over 143,000. So our Tobacco Prevention and Cessation Program also receives funding. And while the program itself is known as the Tobacco Prevention and Cessation, the funds from the Tobacco Settlement Master Agreement, it's a mouthful, are really to support the cessation programs. So we at the department are the sole funder and supporter of the 2 quit lines in Kentucky. There's Quit Now Kentucky, which is also known as 1-800-QUIT-NOW. And then My Life, My Quit. And My Life, My Quit targets specifically those individuals under the age of 18 to help them stop tobacco use. There is kind of a little concern with some of the uncertainty at the federal level and how that will impact kind of more the prevention efforts, but it's worth mentioning here that the federal tobacco control program was disbanded. So we've kind of lost that infrastructure for supporting technical assistance in implementing evidence-based practices to help people not only stop tobacco, but start or to prevent them starting to begin with. We did see a slight decrease in the program successes in fiscal year 25. Last year we had provided over 10,000 or reached over 10,000 students. This year we had a slight decrease. We also saw a decrease in the new counties that were receiving the vaping prevention education. And also a slight decrease in the number of individuals who are seeking cessation service and support. But that kind of stands to reason, as if you are able to prevent, the new use of tobacco, vaping, nicotine products, you would see a decrease in the number of people who are reaching out for cessation services. So I don't necessarily see that as a negative. We do still continue to get outreach requests from schools and communities and students themselves to begin to address youth vaping and other nicotine product uses, some nicotine pouches and those types of products. Our lung cancer screening program was a relatively new program in fiscal year 24. And so since that time, we have been able to do increase, as you can see here, we did 55 lung cancer screens or scans to see that is targeting individuals who might be at risk for developing lung cancer. So this program really is kind of that prevention. Let's get them screened. If they have a positive screen, then we can get them into treatment early. And because of the success with the lung cancer screening program, Kentucky is being looked at as a replicable model across our framework for other states that have low screening rates. And some highlights also with the program. In 2024, the American Lung Association said that over the last 5 years, Kentucky has shown improvements in a 12% better incidence, which is the new cases of lung cancer. So we're identifying individuals early. We have a 30% better 5-year survival rate. And if you know anything about lung cancer, it has about a 5-year survival rate after treatment. So that's really important that we are seeing people that are actually surviving beyond that 5-year rate. And then we've had a 14% increase in early detection. We continue to get the word out. We are really targeting building that collaboration. As I mentioned, it was a new program last year, so they were just kind of building that infrastructure. This year, they've been able to increase our outreach efforts. And Kentucky is one of the only states that has a survivorship advisory committee. And again, that's another thing that is being considered as replicable in other states. Our early childhood oral health program continues to support our 36 local health departments in their dental varnish program. Dental varnish is a quick, easy treatment where they basically paint varnish on the child's teeth, and that helps to prevent tooth decay and cavity development. We did have fewer services in FY25. We increased the number of trainings. Last year, they had only been able to provide 10 trainings. We were actually able to double that and therefore double the amount of public health nurses that received training. We continue to supply those varnish kits. That those rates are going back up to what they were pre-COVID pandemic. And we increased the number of dental school graduates that we are supporting. We support dental school graduates on kind of like that debt repayment if they agree to go work in those underserved areas. And we've expanded the number of our dental hygiene teams. We do continue to support the Pike County Health Department to revitalize their dental suite. We had hoped to be able to report that that project was fully funded and operational, but if you've ever done any sort of renovation, you know the best laid plans oftentimes get delayed. So that is an ongoing project. We also, on here it says that we continue to support the dental schools, U of L and UK dental schools, in revitalizing their dental suites, but that actually we have been able to fully fund those projects. And what they did was create quiet rooms so that for young children or individuals with an intellectual developmental disability who may be anxious going in to see the dentist, they have a quiet room so they're actually able to provide better care for those individuals. And then last from public health is early childhood mental health. And this is actually a joint collaboration with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. We support early childhood mental health services, and these are actually, as you can see here, the accomplishments. Those are an increase from what was provided in FY24. In FY24, we had just slightly over 3,200 billable hours. That increased in FY25. We increased the number of trainings offered by 34. Last year it was 100. This year we were able to offer 134 trainings, and then also increased the number of early care and education staff who received training.
The Department for Behavioral Health, Developmental, and Intellectual Disability uses the funding that's provided to support pregnant and parenting women, children, and their families throughout Kentucky. The first program we support is the Early Childhood Consultants, or ECCs. These are consultants that are placed in each of the 14 community mental health centers across Kentucky. The mission is to provide trauma-informed, evidence-based interventions. This year, we saw a meaningful increase in the amount of people served, both the pregnant and parenting women and children. These services include things like observation, consultation, training, outreach, coaching, and connecting families to needed resources. Our ECCs also coordinate and collaborate with numerous community partners, helping ensure families receive comprehensive wraparound care. Next slide, please. The other programs that we support provide services for pregnant and parenting women. These programs are designed to help families achieve stability and recovery. One of the key programs we support is Kentucky Moms Maternal Assistance Towards Recovery. This provides substance use prevention and case management services for pregnant women and children and supports the pregnant women 12 months postpartum. Program staff are placed in each of the community mental health centers and provide services across all 120 counties in Kentucky. This year, we saw significant growth in the prevention activities that resulted in more individuals being reached statewide. We've also enhanced our evaluation process for this program. Based on this year's results, the program achieved a 72% reduction in substance use among women that participated. Only 5% of women involved in this program had labor or delivery complications, and 0 babies were born with birth defects among the participants. In addition, this funding also supports substance use disorder treatment for pregnant and parenting women in partnership with local community treatment programs. We are proud to support several key partners across the state. The first one is St. Elizabeth's Baby Steps. This one is located in northern Kentucky. The program provides recovery, employment, and housing supports, as well as education classes. They offer comprehensive health care services, including medications for opioid use disorder. Next slide. The second program is Haven for Change. This program is located in Bowling Green. It's a transitional living environment that helps women and their children stabilize and rebuild. They provide recovery supports, job training, and child care assistance, and have a strong focus on family reunification. The next program we support is the Chrysalis House, located in Lexington. The program offers 3 residential treatment facilities with a capacity of 48 pregnant and parenting women and their children. They provide residential substance use disorder treatment, as well as outpatient treatment, intensive outpatient treatment, and medications for opioid use disorder. They also operate a National Alliance for Recovery Residents, or NAR certified apartment that provides safe housing for women and families in recovery. The next program we support is the Independence House. This program is located in Corbin. This offers residential treatment for this residential treatment facility provides education, employment, housing, and basic needs supports for families. They also operate a little recreational activity center which supports mother and child bonding and therapy. The last program we support is Sky Hope Women's Recovery Center, located in Somerset. The facility has 100 beds and serves women seeking recovery and stability. They provide housing, recovery programming, education, and employment training, and support for basic needs, all focused on helping women rebuild their lives. Together, these programs demonstrate a strong, coordinated approach to supporting pregnant and parenting women, children, and their families throughout Kentucky through education, prevention, substance use disorder treatment, and recovery supports. And we are making measurable progress in improving outcomes and building healthier futures for families across the Commonwealth. Thank you.
Next, we're going to discuss the Early Childhood Development Program. Next slide, please. So, research shows that accessible, affordable, quality childcare has significant benefits for parents, children, businesses, and the economy. The Child Care and Development Funds is the federal grant that is designed to promote success for children, employment for parents, and economic security for parents by ensuring stable, high-quality child care. As you can see here, child care subsidies last year, over 23,000 families were served, which was a little over 39,000 children. And that is in 1,193 regulated programs throughout the state. And those can be licensed child care centers as well as certified family child care homes. Next slide. So what is Kentucky All-Stars? What is quality? Kentucky All-Stars is our 5-star quality rating and improvement system for early childhood education programs. Programs that participate demonstrate a commitment to quality by focusing on family and community engagement, classroom and instructional quality, staff qualifications and professional development, as well as administrative and leadership practices. As you can see here, this is a breakdown of how centers and certified family child care homes rank across the state. We currently are sitting at 34% of our regulated programs are considered high quality. We are steady from last year. We've gained an additional, I think it's 4 that are considered high quality from the report last year. The tobacco settlement funds help to support, as I mentioned, professional development. We have issued 1,426 scholarships for the Commonwealth Child Care Credential, 418 mini grants for the nationally recognized Child Development Associates, 292 Milestone Achievement Awards, as well as 130 education reimbursement grants. So high quality classrooms, they have warm and responsive interactions between children and teachers. They have developmentally appropriate materials, help children learn how to play, work together, and make friends. They focus on a child's physical development as well as their social emotional development, their cognitive skills, and language skills. High-quality classrooms create an atmosphere where every child feels welcome and can participate successfully and have lots of different opportunities for learning and play. Why does that matter? That leads to better parent-child relationships, improved thinking skills, better attention skills, enhanced academic performance, better relationships with peers, and a greater chance of finishing school and attending college. How do we stand out? I'm going to brag on the ECE sector for a minute because we are recognized a lot nationally for some of our innovative thinking, especially listed on here the Employee Child Care Assistance Partnership Program and child care employees classified as a protected population. The General Assembly last year made an additional appropriation to help increase the funding for scholarships that are offered through the Early Childhood Development Scholarship Program through KIA, so that it helps those working in the early childhood setting to, not only better themselves with higher education, but also those atmospheres that they're creating for our youngest learners.
Thank you. Does anyone have any questions? I believe Representative Dossett.
Thank you, Mr. Chairman, and greatly appreciate the presentation that you've done. I think it's important for our members of this committee to know these are the things where the tobacco settlement dollars go. Each one of these meetings, you're learning different aspects of what this money touches and the impact that it has and what we're able to do. And I'm proud that I have served on this committee going on, well, a little over 15 years. Do have a couple of questions I wanted to ask. When we're talking about the vaping programs within the schools, this is something by having an 8th grader in our family and what we're seeing with the trouble with the vapes. Now we have THC from the Delta 8 and Delta 9 in those vapes. Those children, not only if they are caught with a vape now, sometimes it's not only nicotine, but it's showing us THC, not marijuana, but a chemically manufactured product. Are we putting anything in the presentation that we're doing in the schools to allow these young people to know that there are drugs in this that are man-made that we do not know what the consequences could be in the future?
If you'll indulge me, I'm going to ask Elizabeth Anderson Hoagland to come up. She is our program coordinator for that. She might be better able to answer that question as far as the what sort of programming is happening in the schools. Elizabeth?
Good morning, Am I on? Good morning, everyone. I'm Elizabeth Anderson Hoagland. I'm the Chronic Disease Prevention Branch Manager here at the Kentucky Department for Public Health, and actually started out in the Tobacco Prevention and Cessation Program back in 2011, and I was the Youth Prevention Specialist for the state. And so I was working in the tobacco program when vaping kind of hit this country and really took off among teenagers. And I think what I would say to the question about other chemicals, other substances that might be involved in vaping products, is that we really focus on the skills, like the skills of refusal, the skills of navigating when your friend has something and it smells good and they're telling you, why don't you try this? Giving teenagers the skills to say no and still keep that friendship. And so that is something that you can use across substances. So, I mean, yes, we can talk about nicotine, we can talk about THC, we can talk about all the other substances that might be involved, and those are going to change over time. But it's those refusal skills that you can use with a variety of substances. That's really something they can carry forward no matter what's being involved. Does that help?
Slightly. I think we need to make sure, Mr. Chairman, I think we need to make sure we get this information to our young people, because if they're being caught with THC in a vape, it's considered marijuana. Mm-hmm. And I would really like to see us put some emphasis on that. Not to mention, And this is another issue with the THC in the vapes, and now with it being in alcoholic drinks. As adults are going in for job interviews and they're taking a drug test, they're testing positive with THC. And that could cause them a loss of a job. So it is something that's really crossed my mind. I see it there within our school system, and something that I'm become really has gotten hold of me here over the last couple of months. Mr. Chairman, one more. On our early child care programs, and something I'm very, very proud of, our STARS program there within our daycare centers. That is something that the funding that comes from the settlement dollars goes towards that for those daycare workers and to help those parents that are low income being able to have access to child care. Now, something I was been disappointed with the group that the governor put together concerning pre-K is that there were no child care owners involved in that, which is very important because in the conversation you have with daycare owners, they lose money on infants, 1, 2, 3-year-olds, where they're able to make up that difference and show a little profit is on those 4-year-olds. So we want to make sure that those daycare owners have a voice. We understand there's a shortage of daycares. We do not want to do anything that impacts and closes a daycare down and puts our families at home at risk of not having daycare. But I am greatly appreciative knowing what these dollars have done and how many young families that have been helped and those children that are better prepared for school because of the program that you have done training the daycare workers. Thank you, Mr. Chairman.
Thank you, Representative Dawson. I've got a follow-up on his too, and you may have to help me articulate my own question here, okay? But understand with Ms. Hoagland talking about the coping skills and everything that cross over all different types of topics. There's an educational component to this too. Law seems to trail what happens just by necessity almost. It's hard to be proactive. I know she said that she was in tobacco when vape started. I'm quite confident that they weren't sitting around, there's going to be these things called vapes in the future. Or if you do, I want to borrow your crystal ball for a few things. But is there anything as we move more into the THC products that y'all have identified that maybe needs some statutory assistance or anything that we need to do in this upcoming for education and or cessation or prevention?
Well, I guess one of the big things is we do the best we can with what we have, the resources that we have. So finding a way to support the program. I mentioned that there's uncertainty at what's happening with the tobacco control program at the federal level. That is directly impacting our state program to be able to address those prevention activities to get that word out. I know that in this past session there was a bill introduced that would divert some of the Juul settlement funds to the Department for Public Health to support youth prevention activities. So that is an area that we would be interested in seeing coming around as we move into the 26th legislative session. Other than that, it's, again, if we had a crystal ball, we could figure all of that out. I know that there was, I believe it was before licensing, occupations, and administrative regulations, there was questions that came up about the cannabis-infused beverages and being able to try and get in front of what's coming next. Because as we've seen, we think we have a handle on one thing, and then there's something else that comes along that we weren't prepared for. So we're always trying to play catch up. So being able to find a way to really support programs that are looking at this to get out in front of that. I know that doesn't directly answer your question, but without.
It does a lot. I thought the sponsor of that Jewel bill had a good idea last year. Following up on this is when you touched on a question that I had. Can you talk a little bit about the loss of federal dollars with this federal program? You said you lost infrastructure. Can you explain what infrastructure we're now having a gap on?
I can try. So
don't take us too deep in the weeds, please.
Well, that's where I'll try not to go. We rely a lot on federal programs. When we receive federal money, that comes with a level of technical assistance. And the technical assistance involves looking at those evidence-based practices, those promising practices that really address what the money's earmarked for. So we would rely on some federal guidance of, tobacco prevention. This is what's working in this state. This is an evidence-based practice. How are you able to replicate that in Kentucky? Are you able to replicate that? And that's where we're really losing that connection. And because there was a delay in receiving our federal grant for the tobacco prevention program, we lost staff because they were worried that their program's not going to get any more funding. They have lives, they have mortgages, families they have to support. So we lost staff. So that's one of the areas that I say we lost that infrastructure. We lost that connection at the federal level. We've lost our internal infrastructure moving forward. So we're trying to regrow the program and build it as best as we can with what we have available.
So this federal program with the money became data information on different programs, different bases for those programs.
Yes.
Apparently, I got a good night's sleep last night, so I've got a few questions. Committee, bear with me, and if anybody has a question in the middle of this, I do not mind stopping what I'm asking for your questions. I didn't see it in here, but I'd like to see a breakdown of how the different funds are allocated as far as programs versus administrative and everything. I figure y'all have that. It's the right person can hit a couple of buttons and print that. If you can just have that trail,
okay,
I'd appreciate it. Any of these programs that we have in your presentation, and thank you for putting this together today. Are any of those programs, are all of those programs self-funded with the tobacco settlement, or do they combine with other funds? I know we talked about the federal funds there. From a state level, are there any of these programs that are partially funded through other pools of money or piles of money that come through different programs in the cabinet or anything?
I'm thinking from public health, I would have to double check on a couple of our programs. But I know the HANDS program is not solely funded from these tobacco settlement dollars. The tobacco prevention is not. Lung cancer? Is lung cancer?
And I'm not trying to put you on the spot on this. Can you trail that information to?
Yeah.
It seems we're having a pattern of not being able to manage budgets right, and having gaps in funding. And I want to make sure that the programs that the Tobacco Settlement Fund support don't get caught up in problems elsewhere. So that's why I want that information, asking that for that information. Thank you.
Well, and our lung cancer screening program is one from public health that is solely funded with tobacco settlement dollars.
So in the hand, I'll start with you. You were talking about the HANDS program. What's your target demographic for this program?
It is any individual who is pregnant, who has a newborn. It's not income based. It's not an entitlement program, so you don't have to meet a certain income threshold to receive services. We do a screening that the maternal infant early childhood home visitation program at the federal level, the McV program, they have given certain demographic or certain screening questions that if someone has a positive on that, then they are eligible for services. But it's not this program or an entitlement that you have to meet a certain threshold. It could be anyone who is pregnant or has a newborn.
I'm assuming there's no way you track this or even could track it. Do you have a problem? How much of a gap or how much issues do you see developing for people that have these services available but don't step forward and take advantage of the services that you have?
So we have seen over the last couple of years, we did see a drop in our enrollment. In 2016, we had the highest level of enrollment, and I want to say that was just right around 9,000 families enrolled. So we've seen a decrease, but now we're starting to see that go back up. So we are increasing our outreach efforts to be able to reach the families, let them know it's not, because there is that, I guess, not really stigma, but that perception that this is a program for poor people or for at-risk people, and I'm not one of those, so I'm not going to take advantage. So we are really increasing our outreach efforts. We also are veering away from the home visit and putting out there as this is a home visit, because a lot of people are skeptical when we say that this is a program that can support you, and we do it through these methods. We get a lot more interest in the program. And then we always have people that start and for whatever reason just don't continue.
Sure. It's a great program. You led me into my next question. Thank you. You talk about the home visits. I noticed you had there in person and virtual. Mm-hmm. How does that work?
So families can, when they have different levels, and a family that is a level 1 is receiving those weekly home visits, and those will back off when they progress, they meet certain outcome measures. It may go to every other week. Virtual home visits, they have a limited number that they can do. Our home visitors can do a limited number of home visits through virtual means. And it has to be through a HIPAA compliant platform where they can connect with the family. We started that during COVID, and that is one of those things that we did continue, is to allow no more than 25% of a family's home visits can be done through virtual means.
Do you think that's helped keep people engaged in your program some?
I'm going to say it depends on the area. In some of our more rural areas, they're not using virtual home visits at all because they don't have the means. Either the family doesn't have Wi-Fi, they don't have stable Wi-Fi. They just prefer to be that in-person connection. Mm-hmm. In some of our larger areas, they're wanting to do more virtual visits, but still we are limited to that 25%. I do think that is connecting with more people.
Is that something that you're continuing to develop out as you go? Because all of this is relatively new, and
Yes.
it has lots of great potential. I just wondered, how do y'all develop stuff like that?
Usually reactively, but we do. Our HANDS program staff do a great job with collecting both that qualitative and quantitative data to really address, are we meeting those benchmarks? We are accountable to HRSA for the funding that they're giving us, so then we have to show, that we are meeting certain benchmarks to be able to continue being an evidence-based program and receiving those federal dollars.
Sure. I want to talk about your lung screening program. Did you say that just started in 2024? 22.
Sorry. 22.
Did it replace another program that was in the lung cancer screening area that went away, or?
No. Sorry.
I realize it's not your decision at all,
Right.
but so I don't mean this as an attack, but why did we wait so long to do lung cancer screening with tobacco settlement funds? Is there any history in that you know of that you could share?
Not that I'm aware of.
Who do you work through to get your candidates for screening? How do you identify people to screen?
Elizabeth.
You shouldn't have left. Come back up here. Come on. grab you a chair. Pull it up.
I'll just settle in. So, when it comes to lung cancer screening, current guidelines are if you're between ages 50 and 80, have a 20-pack-year smoking history, and are either a current smoker or have quit within the past 15 years. And so we have a couple of different initiatives we're working with the lung cancer screening program, and we do directly pay for screening for people who are underinsured or uninsured, and we partner with the Kentucky Cancer Link is who we use to directly make those payments for screening programs. And we've worked with them with a variety of cancer programs at DPH. We also do some quality improvement initiatives with healthcare programs, which is that QUILS initiative, which increases the referral and screening for lung cancer.
Do our medical providers kind of funnel people that need this through? Is there any connection with our medical providers in the state?
Yes, Kentucky Cancer Link, they work with a couple of different healthcare systems, and I know off the top of my head, one of them is St. Elizabeth's. I couldn't name any of the others off the top of my head, but we can get that to you.
Is this something where, I know there's kind of like there's no way to anticipate the next thing that you have to deal with. Is there any way to tell if this is gaining momentum and there are a lot more people out there demographically that we're not serving? Or is that number going down as the tobacco consumption has gone down? Does this program grow from here, or are we right at about the level we think we're going to be?
I would say we are still in the growth phase because lung cancer is a late-term consequence of tobacco use. We are seeing, lung cancers from people who started smoking in the 60s and 70s and 80s. We didn't really have that robust tobacco control. So we are still seeing very high lung cancer rates, especially here in Kentucky. And since this is a newer program and we're just getting that infrastructure started, I think we're going to see a lot more demands upon resources.
Great, thanks. I've got my next question in here somewhere. Here we go. In the early childhood mental health, y'all may have to swap out again. I told you should have just pulled your chair up there,
Don't go forward.
So in the early childhood mental health slide, I believe it was 17. You don't have to go to it or anything. You noted on there 3,422 hours billed to private insurance and Medicaid. Who bills that?
That would be the provider billing.
So that's regular mental health providers that bill through in connection and coordination with this into insurance, public and private.
Yes.
Is that a low number? I'm trying to work through my question here
Right.
because we need more services in this space, and it's one of those things that is frustratingly slow to a lot of people to connect to as a real medical issue in the mental health space. And I didn't know if this is kind of embryonic and where we're going to go, and if we need, as a legislature, we need to be paying attention to how this develops. That's the context of my question.
Right. So these funds support one early childhood mental health consultant per region. So we have 15 area development districts. That's our community mental health center regions, follow those lines. And we support one professional in each region. So this is, for the global scope, that's probably a low number, but for the work that the 15 individuals are doing, that's probably on par.
I turned myself off there. I think Sarah had this line about the early childhood consultants. How do we identify who we serve in that space?
So each of the early childhood consultants are placed in the community mental health centers, which serve as our safety net, of course, for behavioral health services across
One of those
the state.
15 that she was just talking
There's
about.
14 community mental health centers.
Okay.
But they do serve all 120 counties. But when someone comes in, and if as part of their screening process, they look at the programs that are offered within the community mental health center and provide that linkage to those services. Obviously work very closely with the schools as well.
Yeah. In the substance abuse prevention and treatment, I've got a couple of questions on that. How did you choose which facilities to support? Were those the ones that were most ready and you moved in? How did that work?
So we're looking at facilities that are designed to support pregnant and parenting women. Not all treatment facilities, especially residential treatment facilities, have the capacity to be able to have that specialized care for that population. Thinking about like prenatal treatment, parenting classes, other things in addition to the substance use disorder treatment services they're providing.
So in terms of how support's defined, is that just money, or does the cabinet provide services in with the services provided in those facilities?
Yeah.
If you followed that.
I did. I got you. So we do provide funding, but with any entity that we contract with, we have program administrators that are assigned to oversee that contract, and part of their role is to provide technical assistance. So looking at providing evidence-based practices and training and support, helping with implementation of new strategies as they grow or expand the services that they're offering.
This demographic struggles with a lot of things. I noticed your 1 year postpartum office. Do you track how many people actually, how many of your clients actually take advantage of those wraparound 1 year services?
We do.
How often does that work? If you don't know off the top of
I
your
don't
head,
know off the top of my head.
Would you supplement? I'm kind of curious to see.
Absolutely.
You know, we can offer a lot of things, but being able to engage people to stay with the programs that we offer is another difficult task. I know you'll be disappointed, but I think. No, there's one more. But I think this is my last one. And Ms. Day, I didn't want to leave you out, so I knew you would feel neglected if I did.
Thank you very much.
In talking about the ranking systems for the early childhood centers, you had said 34% are high quality.
Yes.
34% out of how many? And do we have all of the facilities? Because you have to register all these facilities.
All that are licensed and regulated. You have to be licensed through the cabinet to participate in the cabinet's all-star program. So that's 1,993, and that, again, 34%. So that's 680. That is a drop from pre-COVID. And I can tell you that is something that we are working on. We have actually just done 2 surveys of child care providers to ask, why aren't you participating, or why aren't you choosing to operate at a higher level, if you will? And so we are aggregating that data, and we'll be looking at changing the regulations around this program to hopefully make it a priority for our providers. What we hear a lot is they're so focused on keeping their doors open and classrooms staffed that quality is really not the top of their list. It's making sure those kids are healthy and safe while they're in care. And so, we're trying to think administratively, how could we better support our providers? So that work is ongoing for us to hopefully increase the numbers of high quality programs we have.
The criteria, the ranking criteria and everything, how is that determined? Is that something you come up with, or is that something like Ms. Brooks mentioned, where it's with some federal criteria that come in with
So our quality rating and improvement system that we use is the environmental rating scales, which was authored by a group out of North Carolina that is nationally recognized, and that's what we follow. I can gather more data to send to you.
Yeah,
about the
don't
breakdown.
take us down a rabbit
No
hole.
rabbit
today.
hole like a one-pager.
But yeah, if you don't mind, because
Okay.
I'd like to see how the levels break down for that and how some of the ranking criteria come in.
Okay.
Thank you. I believe that's all. And thank you for your patience, and committee, thank you for your patience with me today, too. I didn't mean to turn this into a deposition or anything. Anyone else have any questions? Tired of listening to me ask questions? Thank y'all. Thank you for your time here. I appreciate it. There's no